it's really important to sense that living isn't safe. A safe place inside, though, you can find. You want to see what you're afraid of. But then when you see that you're afraid of living or you're afraid of everything, then it's good to realize that fear isn't safe either. Fear constricts you. Fear will blind you. You won't see the way out with too much fear. So then knowing that, there's a place where you say, oh yeah, here I can be next to my fear.
First of all, I would thank Catherine from the International Focusing Institute in New York, and Kevin, the head of the Gendlin Research Center, for giving Palestine Trauma Center, which I am representative, this opportunity, great opportunity. We are very excited and very thankful for everyone give us, and the donors give us this donation. I think this will be in a safe hands. As you know, in Gaza, they have severely traumatized, huge problem on PTSD, post-traumatic stress disorder. We in Palestine Trauma Center conducted, and we use this program as one of the main 4 programs in Palestine Trauma Center. It works very good, and we tried this in last few years, but that was a small research, like 100 and so. From 94% diagnosed severely traumatized with PTSD, it's reduced by using focusing approach, 12 session, 1 session every week, and the 12 session distributed to 3 months. So it's a huge success. So that's in general, the success was 78%, and the participant was 114. So we are going to do like a research in more proper way. So that will be quantitative research, so we can check how much and how the impact of the focusing on the severely or traumatized. From our experience as a Palestine Trauma Center, people found it very, very excited, because it's like no judgment and indirect. We use objects, and it works very, very good with the children, with the families, with anyone. Doesn't need any academic background. So that's one. It's fitted to the cultural, and it worked really beautifully. And hopefully we could even develop this more and try this now with Gendlin Research Center.
This is really a remarkable pivot point, if you will, in focusing research. With the design of the study, as robust as it is, this is a tremendous step forward. Once this research is completed, it will really stand to benefit so many more people who will have access to the research and be able to see what you've done and to see the efficacy of focusing. The other part I also is excited to hear you talk a little bit about was how the community-based wellness project in itself and this particular application of focusing really has a long historical foundation back to the work of Carl Rogers. And while focusing is a procedure, or in a way, experimentally anyway, you could see it as a procedure, but it's done the way you're doing it is brilliant in that it is really taking the Rogerian principles of acceptance and regard and positive understanding and putting those into the research field.